It's absolutely ridiculous.
Good morning, everyone. I'm going to call the Board of Commissioners Finance Committee meeting to order at 11:07. Could we please call the roll?
Commissioner Cavell? Colwell?
Here.
McGillicuddy is absent with notice. Powell is absent with notice. Charles?
Present.
Long?
Here.
Moss?
Present.
Markham?
Here.
You are a president.
Madam Chair, you have a quorum.
Not sure what kind, but, all right. Let's please all rise for the Pledge of Allegiance. Okay, cool. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good one.
Okay, next up, I need a motion to approve the minutes of the previous meeting. Commissioner
moved.
Moss, supported by Commissioner Kowal. Any comments? Please prompt the vote.
Good, I'm aware.
It's the minutes.
Madam Chair, you have 6 yeas, 0 nays.
Okay, thank you. Next item on our agenda is public comment.
Three.
Oh, right. I thought we approved the agenda. Sorry. Approval of the agenda, moved by Commissioner Long, supported by Commissioner Moss. Please prompt the vote. She knows I know who she is.
Yes, I do.
My mother would say, whichever one you are.
That's true.
How many kids?
Isn't that strange because there are 3 of you? Yeah, right, okay.
All right. Oh, Angela showed up.
Madam Chair, you
Yeah.
have 6 yeas, 0 nays.
Thank you. Okay, agenda for today is approved. Next up, we have public comment. This is a time people from the public can address this committee for anything on the agenda. You have 3 minutes to speak. So is there anyone who wishes to address the committee in public comment at this time? Seeing no one, I will close public comment and move on to item 7, communications. We have 2 items there. I need a motion to receive and file the communications, moved by Commissioner Cavell, supported by Commissioner Long. Any discussion? Go ahead and please prompt the vote.
Oh, God, okay.
Madam Chair, you have 7 yeas, 0 nays.
All right, motion carries. Communications are received and filed. Next up, we have item 8, Public Health and Safety Committee recommendations. Item 8A is with the Michigan Department of Health and Human Services for the fiscal year 2023 Local Health Department Emerging Threats Agreement. Moved by Commissioner Charles, supported by Commissioner Cavell. Good morning.
Good morning, everyone. So this application is for our emerging threats funding. And so this goes kind of across the board of, I guess we call emerging threats, from COVID to our lab sewer project that we've brought to you all a couple times, to PFAS response if there is one that's needed. And so this really helps provide funding so that we can staff for immunizations in the fall. As we start to see the new variant of COVID, we're expecting that, vaccinations in the fall will rise again. And this also allows us to continue to do contact tracing, investigation, testing if needed, and wraparound services for that. This also includes monkeypox response if and when needed moving forward.
Okay, thank you. So this is an application for a grant from the state of Michigan. Just
That's correct.
for
And
clarification.
they actually tell us. We don't get to, it's not like you're maybe a grant that says, okay, I need $200,000 to operate this program. They tell us what they can give us in each of these areas. That's what our application is for.
Okay. Commissioner Moss.
Thank you, Ms. Stafford. I have a question regarding the emerging threats. Are you
anticipating this fall either a return or continuation of the mask mandates the last couple of years, or not?
At this time, right, we are currently in a low status, right? If we get to a high status, we will look at, ways to protect the public, right? Usually it's a recommendation for masking, indoors or outdoors. And so, unfortunately, I can't estimate whether or not there will be a mask mandate. But at this point, we all know kind of those things that work and that we've seen work in the past. And so we will continue to either recommend those or, whatever we need to try to protect the public.
Okay, so that's a definite maybe.
Yeah, right.
Yes. Like I said, it's hard to tell, right? It's hard to see how, the levels will go and what precautions we need to put in place to try to protect the public.
Thank you.
Commissioner Kowal?
Thank you, Madam Chair. Thank you, Leanne. I know you have no say-so over this, but it's kind of curious that they threw PFAS in with everything else COVID-related. I guess PFAS is an emerging threat, I guess, but do you have any comments? I mean, what are we supposed to do in regards to PFAS? It's like an overwhelming problem all by its lonesome.
It is, and so because we already have, that's why they've kind of changed it to emerging threats, right? It's not just about COVID. So, PFAS is that emerging threat as we sample more and more and start to see the effects of PFAS, the chemicals that we use in a lot of things or, are in a lot of items. As we start to see them in the groundwater, we need to, try to remove those or create treatment plans that will, ensure that they are not impacting us as, in public health or community health. So what that is for us to respond if there is an elevated level found is that there's an opportunity for water to be provided or filters to be put on systems where there are wells in that community. And so that allows us to, be reimbursed to be able to provide those. So that's that funding for PFAS.
Okay, thank you very much.
Anybody else have any questions for Leanne today? I just want to follow up just a tiny bit more on the PFAS question because it's my understanding it's not a big issue in Oakland County yet. Is that correct, as far as you know?
Yes, at this point, right, the thing, we're watching sites, right, that are maybe testing over time. Again, once we're notified of them, because sometimes the state is handling it, this is where that funding comes in. Once we're notified, we kind of spring into action to do education around and help those homeowners that may have been impacted.
Okay.
But there will be more and more testing, I feel like, moving forward to ensure that, it's not in water sources. But the major water sources test for this and have identified if they even have traces of it.
Okay. Thank you. Commissioner Moss has another question.
Yeah, I may have missed this, is that for PFAS, are you anticipating having point-of-sale testing as a condition of the sale being approved?
I do not have that information at this time. We're not just, you're talking about for wells or septics?
Either, any and or.
There are discussions at the state and, lots of times that there's some kind of septic code put in place, like a statewide septic code. At this time, that's not something we're discussing here at Oakland County or that we've discussed in the health division.
Okay, thank you.
Okay. Anybody else? Seeing no one else, let's go ahead and prompt the vote.
I gotta end that meeting going on.
Madam Chair, you have 7 yeas, 0 nays.
Thank you. Motion carries. Next up, we have item 8B, authorizing submission of the 2022-2023 Oakland County Child Care Fund Annual Plan and Budget to the Michigan Department of Health and Human Services. I need a motion. Commissioner Cavell, supported by Commissioner Charles. Good morning, everybody.
Good morning. Hi, I guess I'll start. Good morning, Commissioners. My name is John Cooper. I'm the business manager for the Circuit Probate Courts. Also here today is Tom Shire, who's a local director for MDHHS. We have Melissa Reed, who's our chief of casework. We have Heather Calcaterra, who's the manager of the Children's Village, and Lori Strong, also with the Children's Village. And then Chris Bujak, who's our chief of business operations at the court. And finally, Pam Mondo, who's our deputy court administrator. We're here today to seek your approval to submit the FY 2023 Child Care Fund budget to the state of Michigan. As you can see by all the individuals here present, this is a very collaborative effort between the Circuit Court, the County Executive's Office, Children's Village, and the state and county's MDHHS offices. The Child Care Fund is kind of a unique funding arrangement between the county and the state. It was established by statute whereby the child care costs are shared at 50-50 between the state and the county. The funding is to support placement costs. It's also to support program costs for youth in both child protective proceedings cases and delinquency cases. All the costs are for youth under the Circuit Court's jurisdiction only. Up until FY 2021, the county always paid 100% of the youth costs up front, and then the state would reimburse us at 50%. Then along came the state pays first legislation, and under that legislation, for child protective proceeding cases only, the state now pays 100% of the cost up front, and the county reimburses 50%. But for delinquency cases, still the county still pays 100%, and then the state reimburses 50% still. For purposes of this plan and budget, the costs are broken down now into about three main categories. The first is out-of-home care costs, which are like private placement costs. Then there's the facility costs, which is our Children's Village. And then finally, in-home care component costs. In-home care, we have 4 programs, going to be 5 this year, hopefully, with a new one being created. We have an intensive probation program, a reentry program, a juvenile drug court program, wraparound program, and the new one would be a juvenile mental health court program if everything falls into place. These in-home care programs are designed to keep the youth in the home to try to avoid in the community rather than to avoid the higher costs of placement. For the child protective proceeding case costs, we categorize those as foster care, supervised, foster care, agency placed, institutional, and independent living. So the bottom line is the FY 2023 budget this year reflects gross expenditures of $32 million with a net expenditure of $28.2 million. These expenditures are all included already in the county executive's recommended budget. They're just packaged a little bit differently for the state and their requirements. It also reflects $1.94 million in neglect and abuse expenditures, which represents the county's 50%. I guess that's it for right now. We're looking for your approval to submit this to the state and answer any other questions that you may have.
Okay, thank you. Do any of the commissioners have questions? Commissioner Cavell.
Thank you, Chair. Hi, John and everybody. Can you speak more to the juvenile mental health court you mentioned as a possibility? What has to happen to create this?
Well, first of all, we have to get approval by the state for this because it's a new program. So this is, when we submit this to the state, but we've got proof in concept. We've got approval already from them. We, of course, ran the program by them, and everything looks good. it meets all their requirements and criteria. So it looks like it's good, and it's also tied to some money that we're supposed to be getting in a grant, hopefully, with our application is with the state on that, and we're hoping we're going to need some of the money in the grant application. So it's kind of a little bit tied to that as well. So that's why I'm kind of indicating hopefully. Melissa, did you have anything else that you might want to say to answer his questions?
We're just hoping that the Juvenile Mental Health Court will help prevent the need for residential treatment placement for a number of youth who suffer from mental illness. We do have a few stats that Children's Village had provided that upon completion of residential treatment programs, 66% of those youth were placed on psychotropic medication. So we're hoping if we address the mental health needs well in the community, it may avoid the need for placement.
Okay. Is the grant request, it's this MDHHS one, or is it also from Scale because it would be a court or something different?
It's a Scale grant request.
Gotcha. Okay. Thank you. When do you hear?
You're
Oh,
welcome.
when do you hear back?
Well, we're hoping to hear back sometime in August. That's typically August or 1st of September. That's typically when we hear back from them and what our grant awards are going to be. And we have 3 other ones with them that we're expecting too. So we were expecting a lot of funding from the state. So hopefully we'll hear earlier rather than later, but probably late August, early September.
Thank you.
And may I add, when we do hear from the state, hopefully they will grant our request for funding. We have a judge identified, we have a team in place, we have participants that are also identified so that in the fiscal year when it starts October 1st, we can hit the ground running. So we're really excited that this will help.
Anybody else have any questions? Okay, seeing no one, let's go ahead and prompt the vote.
Madam Chair, you have 7 yeas, 0 nays.
Excellent, motion carries. Thank you, everybody.
All right, thank you.
All right, and the last item under Public Health and Safety Committee recommendations is appropriating American Rescue Plan Act local fiscal recovery funds for the Oakland County out-of-school time learning supports investment. I need a motion. Commissioner Powell, supported by Commissioner Cavell. All right. Good morning.
Good morning. I'm Alice Adi-Figueroa, and I'm on the ARPA team on the executive side. And Ms. Gilchrist was unable to join us today. In her stead, Sarah Sanders from United Way is with us. What this resolution seeks to do is to address the well-established COVID-related learning delays and learning loss experienced by students due to school shutdowns. In response to that, the school districts got their own ARPA funds called ESSER funds. And we were trying to figure out, was there a role that was appropriate for the county to play? So we spoke to the ISD, we spoke to many school districts, we talked to large organizations that see have regular programming for students, latchkey programs, the YMCA, Boys and Girls Clubs. And what we found was that in some cases, there were programs that existed that really needed some support to make sure that more students could participate. For example, some of the summer school programs that the districts run from 9 to 3. Working parents might find it difficult to get their kids, pick up their kids by 3 o'clock. So our thought was that this could maybe offer an opportunity for districts to apply for an extra couple hours of staffing where students then could stay till 5:30 or 6. Alternatively, there are some large programs where kids are already congregating, but they would need some support to actually implement some best practice programming. So we invited United Way to participate, one, because we wanted some subject matter experts in terms of what out-of-school programming is best practice and meets, a high level of criteria of success. And two, we wanted to run the program as a competitive award. And United Way has helped us in the past, has helped the county in the past run these competitive grant awards. And so what we would do is to offer it up to on-site programming at schools, off-site with out-of-school time providers, or off-site non-traditional learning providers like libraries and rec centers. Yesterday's conversation with the committee added a oversight committee, which is comparable to the one that we have with the nonprofit mental health grant. So there would be representatives from the Board of Commissioners and representatives from the executive side to review the recommended list and the application process that United Way would run. So that's the quick nickel.
All right, thank you. Yeah, that's an interesting phrase, the quick nickel. All right, I'll turn it over to the commission. Anybody? Commissioner Long.
Okay, I realize firsthand that students' grades went down and stuff from online learning, because my kids actually were always above the grade level, and now they're at. So I understand that. But I just wonder what is put in place for accounting wise for United Way for us to see that where the $5 million went. I know we're going to have a subcommittee, but I just want to know, how are we going to know where the $5 million went, and will we get a report of where it went? I'm just a little leery giving $5 million out, as we've been doing to other organizations, without proper accounting, and that we see it here at the board.
Absolutely. And our agreement for the $10 million that we did with the nonprofit grant that United Way is handling for us is they give us a quarterly report that includes information about each of the awardees and congregates the information for us so that we can look and see quickly what are the demographics of the folks that have been served, where are the geographic area where they have been served. They monitor for spend down to make sure that the spending is in accordance with what the agreement is. And they recently added another level of support for these agencies. So in the nonprofit, there are 41 grants that they are supervising. And they have office hours a couple times a quarter where agencies could call in and have discussions with either United Way staff or with other awardees to discuss some of the issues that they might be facing. So by going through United Way, we are actually paying them to be the administrator and to monitor these costs to precisely address those issues, Commissioner.
Okay, then that just sparked another question. How much is the administration fee for United Way out of that $5 million?
$200,000.
Okay, thank you.
Commissioner Moss, you had a question?
I do. Excuse me. Thank you. Do you anticipate this program continuing onward next year, year after that, indefinitely? How long do you anticipate this program to continue?
We face the ARPA cliff like all the ARPA programs do. Our hope is to run it from fall of this year through summer of next year.
When the ARPA money runs out, do you anticipate continuing the program or not?
I don't know of any source of funding that would allow us to do that.
Okay.
We very specifically have to say we are not going to be doing it with Oakland County budget money.
Thank you very much.
Commissioner Kowal.
Thank you. Yes. And then the third whereas, it mentions youth well-being supports. Can you explain to me what that means?
Sarah, do you want to take that one? So that is a subject matter expert question.
I'm reading my point number 3 here to make sure I'm familiar. So when we speak about youth well-being supports, we really mean providing the opportunities for students to practice some of the social emotional learning that has been lost or damaged over the past 2 years with virtual learning and not being able to connect directly. So those well-being supports are, social and emotional, but also, of course, utilizing those partners to make wraparound service referrals as well.
Thank you, and I appreciate you clarifying that because another program, youth well-being, meant making sure that kids had toothbrushes and things like that. So I just kind of wanted to make sure it didn't do the same thing because that would be kind of overlapping and two entities doing the same thing, be duplicity. But that's a very good explanation. Thank you.
Thank you, Commissioner. Commissioner Powell.
I just wanted to check and make sure. I know when we had dispersed the money for the nonprofits with the mental health, that committee overseeing that process, and then for nonprofit groups that did qualify, they could tell us in rubric form or how they qualified, and then the ones that did not qualify from our districts, they also informed us of how we could let them know how they didn't qualify, and also, be it even from a grant perspective of how they may have filled things out, they could even advise them on things of that nature, correct? Well, United Way, right?
Yes.
So I just wanted to put that out there for my colleagues, and especially with Commissioner Long. So if there was any individuals in our districts that you knew applied and you wanted to know why they may have didn't get it or something like that, that information was available. And then you can kind of, talk to the organizations. Because I know that you all are also asking us eventually, commissioners, to kind of help get this out so that our nonprofits could apply for this funding with this this $5 million, correct?
Yes, absolutely.
Okay, thank you.
Okay. Anybody else? Seeing no one, let's prompt the vote.
Madam Chair, you have 6 yeas, 1 nay.
Okay, motion carries. Thank you very much.
Thank you.
And that is the last regular item on our agenda. Next up, we have public comment. At this time, the public is welcome to address us for 3 minutes each on any topic you care to address. So please state your name and where you come from.
Ross Baranko.
And you have 3 minutes.
The emerging threats. I'd like to kind of warn everyone that the masks don't work, the social distancing doesn't work, the shots haven't worked. There's already three shots and going on 4 discussions of daily pills to take because all those of things in the mask and the distancing and the shots haven't been working. And we're currently having meetings, discussions here in the county about mental issues caused by the shutdowns and the masking and the reactions to the virus. It's affected education adversely. There's a great decline in the education. Businesses went out of business and was shut down, and we shouldn't be doing this again. We should let the virus be the virus and let it run its course. There's nothing that we've done that seems to be preventing or curbing anything, really. And you have millions of dollars for repairs caused to the damage of all the shutdowns and the masking and all the parameters that were established before. We should learn by history, not repeat the same mistakes over again. We're already throwing billions and billions of dollars at trying to recover from what we've done as a response to the virus. So to me, it seems like no response is the best response. And we have more deaths that are caused by hospital protocols than the virus itself. And I currently have a lawsuit against U of M Regents. And the Walled Lake Schools, Walled Lake Citizens for Parental Rights had filed a lawsuit against the mask mandates, and the mask mandates were dropped because of the threat of the lawsuit, and we'll be just opening ourselves for a lawsuit if we start doing mask mandating again. So I urge caution on how we deal with these emerging threats. Thank you.
Thank you, Mr. Bronco. Does anyone else care to address the committee? Please state your name and the location you come from. Thanks.
Good morning. My name is Mike Morozovich. I'm from Farmington, Michigan. I actually just have a couple of questions on the last issue. $200,000 of a $5 million grant, you're looking at 4%. Typically an administration fee, 4% seems pretty high. I'd really like to know what they're doing on that. And then the second thing is, because this is educating the children, too many programs too often don't actually measure. Is there going to be a baseline to find out, does this actually work, or are we spending $5 million and not getting the result from it? It's my only comment.
Thank you, Mr. Morozovich. Is that what you said, Morozovich? Okay. Typically, we don't respond to public comment.
And I understand that.
Okay.
Thank you.
But we can get someone to provide you more information if you would care to. Just wait till the end of the meeting and we'll get you some contact info. All right. Any other public comment? Seeing none, thank you. My able assistant over here didn't want to hear those beeps. Seeing no other public comment at this time, then I will call the Finance Committee meeting adjourned at 11:40. Wow. Thanks, everybody. Yeah.